Chairman, this motion would strike funding from the sections on global health and Medicaid for inmates and reprioritize this funding for testing and personal protective equipment along our southern border. In March of 2020, President Trump implemented Title 42 of the United States Code that instructed Customs and Border Protection to prioritize the health of American citizens and reject the entry of anyone who bypassed health screening measures in an attempt to enter the country without authorization. Those who attempt to enter the country in this manner are immediately returned to Mexico. In addition, the Trump administration limited the number of such entries by implementing the migrant protection protocols that allow those seeking refuge or asylum to remain in Mexico throughout their judicial proceedings. These measures successfully slowed the spread of coronavirus into the United States from those entering without authorization. Mr. Chairman, when the unaccompanied alien children crisis occurred in 2014, the Office of Refugee Resettlement, which is under the jurisdiction of the Subcommittee of Health, of Energy and Commerce, that office was tasked with the care and placement. And Mr. Chairman, they were severely unprepared. One of my biggest concerns, and I made several visits down to the Texas border to visit ORR facilities, and one of my biggest concerns was that children, after a brief stay at ORR facilities, were transitioned to local communities, and unfortunately, no one was keeping track if they were up to date with their childhood immunizations, or if they'd been tested for diseases like tuberculosis, or even if they'd had a flu shot. Through the work of the Energy and Commerce Committee, and specifically through my office, the Office of Refugee Resettlement now provides health screenings and vaccinations. Vaccinations for all the usual childhood illnesses to all children in their care. Without this same level of attention for all individuals, I do fear that an influx of people along our southern border will quickly overwhelm Customs and Border Protection and lead to the rapid spread of coronavirus. President Biden has already taken action to halt deportations and is considering rescinding Title 42 before this pandemic is under control. Just last week, President Biden released his U.S. Citizenship Act to overhaul our immigration system and provide a path to citizenship for millions of people who are currently in this country without the proper authorization or citizenship. His plan specifically provides immediate green cards for those currently part of the Deferred Action for Childhood Arrivals program, temporary protected status holders, and immigrant farm workers. For those that follow our laws and apply for a green card, this process typically takes from 7 to 33 months. Under President Biden's plan, those who do not comply with our laws would be rewarded with immediate gratification. In addition, President Biden's law allows all green card holders to apply to become citizens after just 3 years. Currently, an individual must hold a green card for 5 years before applying for citizenship. The plan also eliminates the 1-year deadline for filing asylum claims, meaning any undocumented person currently present in the United States can now decide to claim asylum despite potentially already having been here without the benefit of citizenship for several years. So the plan seeks to address the underlying causes of migration from the Northern Triangle countries of El Salvador, Guatemala, and Honduras. However, the majority of this bill will only further incentivize further undocumented immigration. By providing expediting paths to green cards and citizenship for those who willingly broke our laws, we are telling others seeking entry in the United States that we no longer have an interest in the rule of law. The rule of law will not be upheld. So this threatens to create a surge of illegal border crossings into the coming months. We're already seeing an uptick in crossings. With the coronavirus still a threat, we must ensure that any and all who reach our borders are not bringing the virus or other diseases with them. The Office of Refugee Resettlement has already seen 2,000 cases of coronavirus in unaccompanied alien children in their care. Luckily, none of these cases has required hospitalization. They've also have been 1,300 cases of coronavirus amongst the staff of the Office of Refugee and Resettlement personnel. Any person taken into Customs and Border Protection custody becomes the responsibility of the United States. If any of them require medical care, they will be transferred to local hospitals, placing an additional burden on our already strained healthcare systems. American citizens should not have to wait for care, potentially resulting in, because of increased case severity, because someone who broke our laws is now taking up valuable resources. I strongly disagree with opening our borders for those without the proper documentation. But if this is to be our new normal, let us at least protect our Border Patrol and our communities. We must test every single person, whether they're arriving with authorization or without, that enters our country or crosses our border. In addition, these individuals must be provided with at least one set of personal protective equipment, an N95 mask, and gloves. It will not only help limit community spread, but will protect the brave men and women on our front lines. And I'll reserve the balance of my time.